Excellencies, if we can move forward, then I will come to agenda item 2A, discussion on issues raised by the regional director. It is now noon, so it means that we are like 45 minutes late. And that's why I would recommend that we don't finish at 12:30, but we will continue until 1 p.m. if it's okay for you. So that would be my suggestion, if there is no objection, so that we can catch up a little bit with the time lost. Okay, then now we start this session, which will last until 1 p.m. and we are continuing with discussion on issues raised by the regional director. And I remind you that please be very precise with your time. That means that you have 3 minutes each, and we have a traffic light system, so that means that you will see on the screen ahead of you where you are with the time, or if you run out of time. But please do not do that and stick to this 3-minute time frame. And may I ask the delegates which wish to intervene to raise your nameplates so that I can give you the floor. Okay, we are trying to follow. And first I would like to give the floor to Estonia, which will be followed by Hungary. Thank you.
Thank you, Madam President. I am speaking on behalf of the European Union and its member states, the candidate countries Montenegro, Serbia and Albania, the country of the stabilization and association process and potential candidate Bosnia-Herzegovina, as well as Ukraine, the Republic of Moldova and Georgia align themselves with this statement. We would like to thank the Regional Director for her comprehensive report and for her dedicated leadership. The EU and its member states welcome the work done by the Regional Office towards implementing the 2030 Agenda, both through internal reforms and the support provided to governments. We are pleased to note that the Regional Office has fully incorporated the SDGs into its country cooperation strategies. Furthermore, we appreciate the emphasis on reducing the reporting burden and reiterate the importance of avoiding duplication when reporting on the regional health processes, as well as on the SDGs. We welcome the ongoing collaboration with the European Commission and the OECD to establish a common set of indicators. As NCDs continue to be the main cause of preventable death in many parts of the world, including in the European Union member states, we are pleased to note that progress made towards SDG target 3.4 on NCD-related mortality. Maintaining this progress requires a concerted effort to reduce smoking, alcohol consumption and obesity, and to improve management of NCDs in our region. Finally, with regard to NCDs, we appreciate the efforts to address mental health and welcome the joint call for action by the Regional Director and the EU Commissioner for Health and Food Safety to address mental health issues that affect people of all ages. Antimicrobial resistance continues to be a serious threat to health systems, which is why we applaud the efforts of the Regional Office in driving this agenda forward through enhanced monitoring and improving member states' capacity across the objectives of the Global Action Plan on AMR. The EU and its member states reaffirm our commitment to tackling AMR. In June 2017, a new EU One Health Action Plan against AMR was adopted by the European Commission. This plan contains concrete actions to make the EU a best practice region, boosting research, development and innovation, as well as shaping the global agenda on AMR. We note the work done to address communicable diseases in the region, though we stress the need to upscale efforts in light of the unprecedented high incidence of new HIV cases. The rise in HIV-TB co-infections is a further challenge that requires immediate action. On work related to health systems, we acknowledge the continued comprehensive effort by the Regional Office to achieve strong and flexible health systems which are patient-centered, innovative and cost-effective. and are able to react appropriately to health risks as well as national and international outbreaks of disease. We appreciate the regional director's continuous dedication to this topic and commend her work towards the anniversary celebrations of the Italian Charter in 2018. Madam Regional Director, we note with some concern the imbalances within the regional office budget, and particularly the pockets of poverty mentioned in the interim report. The EU and its member states would therefore appreciate clarification on whether the current budget adequately addresses the health needs of the region. Finally, we would like to extend our gratitude to the Regional Director for streamlining the Regional Committee's agenda and leaving more space for discussion, including on progress reports. Though we note that more can be done, we do acknowledge this improvement and look forward to a constructive meeting. Thank you.
Thank you very much. And now I would like to give the floor to Minister Zoltán Balogh from Hungary, who will be followed by Kazakhstan. Minister, you have the floor.
Dear delegates, ladies and gentlemen, allow me to speak in my mother tongue, Hungarian. Welcome in Hungary. Ő királyi fensége, tisztelt főigazgató.
Royal Highness, Director General, Regional Director, dear Madam Chair, dear colleagues, warm welcome to all of you at the 67th meeting of the Regional Committee for Europe of WHO. It is really an honor that Dr. Tedros, the new Director General, is here with us at this conference. We would like to congratulate for the report of the regional director. I know how important it is for her, for you to enjoy being here in Budapest, and it's important for us that Zsuzsa Jakab enjoys being here in Budapest, because we just borrowed her to WHO and we count on her activity further on in Hungary. The report was really very comprehensive, and it is depicting a very actionful year, and we are very proud of the fact that on the basis of our agreement with WHO, a new service center was opened in Budapest, the WHO Budapest Regional Office, Budapest office, and we've signed the agreement, and with the technical assistance of the regional office, the country office really plays an important role in determining the priorities of the public health program. I would also like to welcome Dr. Lydia Lazari, and let me again assure her that we are going to support her activities. There was a very important part in the report, which was the cooperation of different sectors. I was really delighted to hear that, because we again and again have to reason and argue why we have the largest ministry in the history of Hungary, where culture, healthcare, social affairs, family affairs, sports, culture, national affairs, minority affairs, civil issues are all together and are found a good argument, and that is the cooperation between or among segments and sectors. Since 2011, this is there. This covers 60% of the Hungarian national budget, to provide for an effective cooperation among the different sectors and disciplines. This is a comprehensive cooperation which is badly needed, so that it is not lobby interest that would determine our policies. Like early childhood intervention, Roma integration, it is inevitable to have such a huge ministry and a cooperation within that huge ministry. But what we are really proud of, and we take pride in, is everyday's PE, everyday's physical activity at physical education at schools, because this means that Hungarian primary school students have physical education each and every day. The other major achievement, as it was mentioned by the Prime Minister, is tobacco control. Hungary is now really leading this activity, and we are eagerly looking forward to see the publication of the book of the WHO that will talk about how health investment has a return and a yield, socially speaking, because it is important to regain the support of the rest of the society again and again, because it is in fact cheaper to prevent and to invest in prevention than to try to cure people who are sick or ill. Therefore, we are looking forward to see that book. In addition to intersectoral cooperation, the lifetime approach is very important to us as well, and also career and starting career. This is what our demographic program is based on, and the early childhood intervention. Thank you very much for your kind attention.
Mr. Balog. And now I will give the floor to the representative of Kazakhstan, who will be followed by Bulgaria.
Distinguished Regional Director, dear colleagues, first of all, thank you, Dr. Zsuzsanna Jacob, for this meaningful and interesting report. This report again showed the tremendous work that has been done by the WHO Regional Office for Europe within the Health 2020 policy framework. We understand that within the given time for speech, it's impossible to highlight all the works and support for the member states that was done by regional office. Kazakhstan actively works together with the WHO country office and geographically dispersed office on primary health care. A quick glance to the regional director's report shows that Kazakhstan participated in the many activities, including WHO emergency medical team coordination, self-training, an intersectoral approach to the prevention and control of foodborne and zoonotic infections, surveillance of influenza, emergency risk communications, comprehensive review of programs for TB prevention and control, and many others. This indicates that our government fully supported the initiatives done by the WHO in healthcare sector. Madam Jacob emphasized that the role of multi-sectoral approach in the healthcare prevention. The Ministry of Healthcare of Kazakhstan fully supports such approach as an indication of such support. We have established the National Coordination Council on Health Protection under the government. We also understand that the role of the primary care is essential. Kazakhstan is a homeland of Almaty Declaration on Primary Care, and by taking this opportunity, we would like to invite Director General, Regional Director, and all state members to the Global Conference on 40th anniversary of Almaty Declaration on Primary Care to be held in Almaty on October 2018. We believe that is the time when we need to review the adopted in 1978 Almaty Declaration. Modern conditions such as IT technologies, social, economic, and political development, new research data show that we need to reevaluate and review Almaty Declaration. We think that not only European state members, but all WHO state members must reconfirm their actions towards sustainable development on primary care. This event plans to be on a high level with participation of country presidents, health ministers, leaders of international organizations, and many others. We look forward to seeing all the partners, our partners, on this conference. Only together we can make the changes that will remain in the history. As we say in Kazakh, Kosh Kelinzder, you are welcome. Thank you for your attention.
Thank you very much. And now I give the floor to Bulgaria, to be followed by Czech Republic.
Your Excellencies, Mr. Director General, Madam Regional Director, Honorable Ministers, distinguished delegates, ladies and gentlemen, I have the honor to speak on behalf of the 9 member states of the Southeast European Health Network who have associated themselves with this statement: Albania, Bulgaria, Bosnia and Herzegovina, the State of Israel, Republic of Moldova, Montenegro, the Republic of Macedonia, Romania, and the Republic of Serbia. Thank you, Madam Regional Director and our Europe presenter, for this excellent roadmap on the future work of WHO Europe, on the directions and actions towards implementing the UN Agenda for the 2030 Sustainable Development Goals. This is a very valuable document, and we, the Southeast European countries, expressed our agreement and commitment to it. The SEC Health Network celebrates this year its 16 years of a great regional alliance for health through its 4th Ministerial Forum under the theme health, well-being and prosperity in Southeastern Europe by 2030 in the context of the 2030 Agenda for Sustainable Development in Chisinau, Republic of Moldova on the 3rd, 4th of April 2017. I would like to express our most sincere gratitude and appreciation for WHO Europe's effort and contribution that lead to the very successful political and policy outcome of the 4th Ministerial Forum. In this relation, I would like to highlight and bring to the attention of all our delegates, European Ministers of Health, the outcome signed document of the 4th High-Level Ministerial Forum, the Chisinau Pledge, which set up our policy directions that will contribute to implementing the global UN and WHO agenda for the Sustainable Development Goals 2030. The Chisinau Pledge is an opportunity and at the same time a challenge for the Southeast European Health Network member states. The Sustainable Development Goals recognize that health is a vital contributor to development, sustainability and prosperity, and that it goes hand in hand with strategies that build economic growth, address social determinants of health while taking climate change and environmental protection. In this context, I am proud to state that, firstly, the 9 CEEHN member states already have expressed their commitment to sustainable development by pricing health as an objective and measure to growth, development, well-being and prosperity in our sub-regional SEC 2020 strategy, jobs and prosperity in our European perspective, endorsed by our economy ministers in November 2013 under the sub-regional policy and implementation SEC regional cooperation process and the Regional Cooperation Council with the EU and the ES as major partners. Secondly, all of the SEC-HN countries have taken actions in this respect at national levels in various ways. The number of countries in the SEC region developing and implementing national health policies aligned with Health 2020, committing to intersectoral government policies, has almost doubled. In order to boost the process of the implementation of the Sustainable Development Goals Agenda 2030 in the SEC-HN region, with the Chisinau Pledge in our hands, each country has committed itself to undertake a joint initiative with the networks and its partners' support in order to integrate the SDG agenda into their own national planning process. I would like to use this occasion and express once again our true gratitude to the World Health Organization and in particular to its European Regional Office and our Regional Director, Dr. Susanna Jacob, for her tremendous support over the last decades to the Southeast European Health Network, which makes the Southeast Europe region voice be heard, for supporting us to advance public health gains and our genuine aim and commitment to achieve the Sustainable Development Goals 2030. Finally, I would like to call on our other partners and the European Commission, WHO Europe, and all other UN agencies to support us in our practical endeavors at regional level to implement all of these three major policies as expressed in the EU policies, the WHO Europe Health 2020, and the UN Agenda on SDGs 2030. Thank you for your attention.
Thank you very much. May I again draw your attention to respecting the time frame, which is helped by the screen and the traffic light system. So now I give the floor to Czech Republic, followed by Austria.
Director General, Your Royal Highness, dear Madam Chair, dear Regional Director, dear Executive President, distinguished delegates. The Czech Republic welcomes the opportunity to address the 67th session of the Regional Committee for Europe and fully aligns itself with the statement delivered by Estonia on behalf of the European Union. In June, the Czech Republic had the honor to co-host the 6th Ministerial Conference on Environment and Health, milestone in the European environment and health process. We highly appreciate the energy invested by all involved participants into this successful conference. Our thanks belong to the UN family, governments of member states of the European region, regions and cities, non-state actors, and other stakeholders. We believe the conference fulfilled its goals to encourage the governments of the European region of the World Health Organization to strengthen their efforts to implement more effective measures to protect environment and public health, as well as to strengthen the intergovernmental and international mechanisms in the framework of the European environment and health process. The Ostrava Declaration contains clearly defined priorities for the upcoming years and offers the member states of the European region a set of steps leading towards a truly effective solution of complex problems connected to health and environment. The Czech Republic fully supports the endorsement of the declaration by this committee, hoping it will lead to bigger motivation to implement the declaration in its whole scope across the region. To develop as appropriate national portfolios of actions on environment and health by the end of 2018 is a key priority that will help us not to forget the strong link between healthy environment and quality of life. We are prepared to work on the implementation of the Ostrava Declaration goals and to cooperate with all stakeholders, since only a collective action is meaningful. Thank you for attention.
Thank you very much. Now I'll give the floor to Austria, followed by Tajikistan.
Danke.
Thank you very much. I should like to congratulate you. I would like to thank Susanna for her work. I would also like to thank the regional director herself for her report. I'm speaking on behalf of the German-speaking countries of the European WHO region, Germany, Luxembourg, Austria and Switzerland. We support a joint monitoring of the SDGs, the Global Control Framework for NCDs, and Health 2020. We welcome, above all, the integration of health literacy in the joint roadmaps for both strategies. This supports the activities of the member states of the European WHO region who are already active in the field of health literacy, and in so doing they are developing important initiatives to improve the health of their population. Evidence is being borne in mind whereby health literacy is becoming an important health indicator. Many states can already put their hands upon reliable data. The integration thereof in the joint monitoring program will strengthen the worth of this data in terms of international compatibility. The German-speaking member states are working within their inter-country cooperation very intensively on the topic of health literacy, and in this regard we'd like to take this opportunity to make available our expertise to the WHO Regional Office for Europe, particularly with regard to the development of indicators on this topic. In this regard, we would like to flag up the important and auxiliary role of the European Health Information Initiative. The member states of the WHO region for Europe are invited to take part in the technical network for the collection and management of health literacy within the framework of the AHII, and we would look forward to the nominations. I would like to support the statement made by Estonia on behalf of the EU. We welcome the efforts of the regional office to adopt an approach on improving access to medicine in the European region. There are recommendations on working with informal members, and we welcome this. We welcome mutual learning processes, and we are involved in the PPE network. Austria intends, during its European presidency, to look at the issue of access to medicine and to focus on this. Some areas which are important to us and that I would like to mention are to do with mental health, preventing domestic violence, preventing violence in health systems, Often healthcare systems are the only place where women who are victims of domestic violence can receive support and care. Of course, it is vital to continue measures to provide further training to health staff. I would like to flag up an initiative that deals with methodology in Austria, and it has achieved great success. Thank you very much. Thank you.
Now Tajikistan, followed by Switzerland.
Thank you very much, General Director General, Regional Director, ladies and gentlemen, Chairman, all members of the WHO European region. The issues on the agenda are extremely important to Tajikistan, as is the Agenda 2030. We are trying to improve our people's health and give them a healthy lifestyle as part of our overall national development policy. We have set new goals, but we also haven't left out other issues which have been important to us so far. Protecting children and mothers' health is particularly important, as is keeping down the level of communicable and non-communicable diseases. We have taken a comprehensive approach to health because we think it's an essential component of sustainable development. It also helps us to achieve other goals. Moving to a comprehensive universal health system needs, of course, to have a strong health system which will be directed at protecting the health of people and also ensuring sustainable economic development. These two things must be at the core of our work. I would like, before I conclude, to express my gratitude to the WHO Regional Office for the support it has given to our work in Tajikistan. When the Alma-Ati Declaration was adopted so many years ago, it urged us to focus on primary health care. Since then, we have recognized the importance of that, and we have tried to provide primary health care to all those who need it. It continues to be very important. The support we get from the regional office also is, and the 2020 strategy will also, we think, be of great assistance in helping us to promote primary health care. All our policies to protect and improve our people's health will be strengthened by it. So thank you very much again for the cooperation we've had with and the support we've had from the WHO Regional Office and all its member states. Thank you.
Merci.
Thank you very much. Chairman, Director General, Regional Director, Your Excellencies, ladies and gentlemen, dear colleagues. First of all, may I focus what I wanted to say on three essential points. First of all, Switzerland welcomes the ambitious reform goals of the incoming Director General, which we hope will improve the functioning and effectiveness of the World Health Organization. As has been the case in the past, we are ready to contribute to making those efforts successful, in the hope that they will help us to build a mechanism for consultation which is inclusive and effective. Secondly, last May, the World Health Assembly adopted a program and budget for 2018 to 19, which includes a 3% increase in assessed contributions. This is a good step in the right direction, but other steps will have to be taken, we think, if we want to ensure sustainable and solid financing of the work of this organization. Furthermore, we welcome the efforts made by the Secretariat to integrate the Sustainable Development Goals into that programme and budget. Thirdly, the commitment of Switzerland to strengthening health systems in Eastern Europe and Central Asia is aligned with the priorities recommended by WHO in the region more than it has ever been in the past. Emphasis is now being placed particularly on good governance, on control of non-communicable diseases, on health literacy, and on better training for and retention of health staff, as well as bringing down the level of environmental health risks. We welcome the fact that these issues are also being dealt with in the course of this current session of the Regional Committee. Last but not least, at this Regional Committee, the holistic approach being taken to improve access to drugs and medicines, evaluation and monitoring of the implementation of the 2030 Agenda in countries and in the European Office of WHO, and speeded up implementation of the international health regulations will continue to be priorities for Switzerland. Ladies and gentlemen, we will be happy to discuss a strengthened collaboration and cooperation between the member states of this region and the member states and the region. Thank you.
Merci.
Thank you. Lithuania, followed by Romania, please.
Director General, honorable ministers, distinguished delegates, Lithuania fully aligns itself with the statement made by Estonia of behalf of EU and its member states. Let me extend my sincere gratitude in the regional director for your complete report and outstanding leadership. We strongly support the regional director in emphasizing we need to decrease health inequities and differences in life expectancy. Lithuania particularly welcomes the WHO commitment to combat NCDs by adopting action plan for the prevention and control of NCD and providing member states with practical tools how to tackle NCDs risk factors in the full environment and health. We highlight we need for the sequential follow-up of Ostrava Declaration, ensuring smooth implementation and committed involvement of both environment and health sectors. Lithuania recognizes the leadership of WHO in advocating for the right in health for refugees, asylum seekers and migrants by strong partnership and intersectoral approach. We know WHO continued response to large-scale emergencies in Syrian Arab Republic and Ukraine. We stress the importance of efforts in the fight against tuberculosis, and especially multi-drug resistant tuberculosis. We invite WHO to continue to involve a wide range of partners and assist countries in their response to TB on a country level. Let me conclude by stressing why it is a high priority of Lithuania to intensify cooperation with WHO as our strategic partner to ensure better health and to continue reforming our healthcare system. The backup of WHO with high quality health information and evidence enabled us to introduce very unpopular, highly needed policies to reduce harm to health. Thank you.
Thank you so much. Now I give the floor to Romania, to be followed by Slovenia.
Thank you very much, Ms. President. Your Excellency, dear colleagues, dear friends, I would like to thank you and congratulate Ms. Regional Director for the report and for the activities. Actually, in name of my country, I would like to thank World Organization for Health for the technical support, continuous technical support, and in the same time continuous political support. And I think that it's very important that this line of technical and political needs to be together in order to have good results in our activities. As you know, we promote now the law for vaccination, and we have very good support from WHO for this process. It was a very hard process, and in the same time we organized together with Ms. Regional Director a high-level meeting where all the political factors came at the same table, and I hope that the result will be very good. I hope that at the end of this year we will have in plan the new law of vaccination. I would like to congratulate all of you for the activities and thanks for your support. Thank you very much.
Thank you very much. Now I give the floor to Slovenia, to be followed by Belgium.
Madam President, Director General, Regional Director, Crown Princess Mary, distinguished delegates, Slovenia would like to align itself with the statement of EU. We would like to thank the Regional Director for the excellent update on the work of the past year. Slovenia welcomes the determination of Regional Director and its staff to implement our strategic commitments to accelerate implementation of Health 2020, Agenda 2030 and Sustainable Development Goals. We appreciate initiatives such as the intersectoral platform agreed in Paris, the renewed commitments in Ostrava, and the work on social and economic footprint of health on sustainable development. In implementing intersectoral cooperation, however, it is important to keep the focus on the local level and assure that everybody benefits and equity principles are applied. Slovenia has recently signed a memorandum with the European Office to develop together different tools to increase the potential of health sector and support intersectoral investments in health, in particularly in local community. Together with you, we are assessing in Slovenia 10 essential public health operations. We believe that strengthening public health is an important precondition to be successful in implementation and welcome initiatives such as Coalition of Partners to strengthen public health services. In strengthening health system, we look forward to the next Tallinn conference. Since Ljubljana conference, WHO Euro, together with the European Observatory, provided valuable support to our countries in developing good practices and reforming health systems. This June, for example, Slovenia hosted a policy dialogue of 3 neighboring countries, Slovenia, Austria, and Italy, together with the European Observatory, to discuss and exchange experiences of implementing primary healthcare reforms with a focus on care integration, prevention, appropriate skill mix, funding, and paying for change. Evidence, information, and research are the key in informed policy making, and Slovenia is committed to implement the agreed action plan. We are pleased to note the growth of the European Health Information Initiative and would like to thank you, Regional Director, for the leadership in integrating and harmonizing health information in the region in cooperation with the European Commission and OECD. Strong and evidence-based argumentation is in particular important when promoting public health solutions that interfere with interests of other stakeholders. We would like to express special thanks to you, Regional Director, and your excellent team for timely and very adequate support in adopting new tobacco control legislation in Slovenia and introducing licensing, plain packaging, and total ban on advertising. And yes, illicit trade presents a threat and could compromise our action. Thank you, Director General, thank you, Regional Director, for reminding us of the importance of ratifying the protocol. Slovenia will speed the process, we promise. Thank you.
Thank you very much. Now it's Belgium's turn, to be followed by Georgia.
Madam Chair, Your Royal Highness, Director General, Regional Director, distinguished colleagues, Belgium fully aligns itself with the statement from Estonia on behalf of the EU and its member states. We listened with great interest to the report of the Regional Director and congratulate her for the change she has brought to the region. If we want to achieve SDGs by 2030, we need to reflect carefully now on how we can further change our ways of working, thinking and collaborating. Belgium will be very happy to support that. We thank the Regional Director for her leadership, particularly emphasizing our engagement in country work and the establishment of partnerships throughout the public health domain. WHO has a critical role in supporting countries, especially those with fragile health systems. Belgium has always been a strong supporter of the WHO focus on health system strengthening, but countries that have well-developed health systems, such as Belgium, will also still need WHO support. Especially WHO normative and standard setting role is key. We are therefore happy to announce the implementation of Belgium's country cooperation strategy has successfully started with a joint external evaluation of the application of the internal health regulations in Belgium. However, in the future, we should look for a better way to reflect on WHO normative and standard setting role, as well as support to all countries while allocating the budget. I thank you for your attention.
Thank you so much for your short and interesting intervention. And now Georgia, to be followed by Slovakia.
Your Excellencies, Madam Regional Director, Director General, Ministers, ladies and gentlemen, on behalf of the Georgian delegation, I would like to thank the government of Hungary for hosting the regional committee in this wonderful city of Budapest. In 2017, we have made good progress in many demanding technical areas, and we would like to congratulate the Regional Director for another successful year and for an excellent collaboration. Georgia fully agrees with the priorities presented by the Regional Director, as we are particularly interested in strengthening the national capacities in emergency preparedness and further building the strong response system, in tackling the major challenge of non-communicable and communicable diseases, and of course our main agenda, improving the universal health coverage, so that no one is left behind and no one is left without the coverage and no one is facing the catastrophic expenditures on health. Having in mind the high prevalence of smoking among men in Georgia and quickly rising prevalence of smoking among women and youth, clearly indicate why Georgia is highly committed to strengthen the tobacco control, since reducing the tobacco use plays a major role in achieving the SDGs to reduce the deaths from non-communicable diseases and in general improving the health of population and reducing the health inequalities. One of the first steps that Georgia did was adoption of a very strict tobacco control in May 2017, a major breakthrough. The law that is fully aligned with the WHO Framework Convention on Tobacco Control and is one of the strongest tobacco control laws in the WHO European region and beyond. We managed this despite a very heated political debate and the pressures from the tobacco industry. Now, the government is fully committed to enforce and implement the law. Georgia has been selected as one of the FCTC 2030 parties, and with the assistance of the WHO and FCTC Secretariat, and with the strong commitment of the government of Georgia and national stakeholders, we are on the very good way to further make the progress in the area of tobacco control, and by that addressing the challenge of non-communicable diseases in our country. And finally, I would like to, on behalf of my country, I would like to welcome the Standing Committee meeting of the Regional Committee in November in 2017 in Tbilisi, Georgia. Thank you.
Thank you so much. Now may I give the floor to Slovakia, to be followed by Russian Federation.
Madam President,
Your Royal Highness, Director General, Regional Director, distinguished colleagues. Slovakia fully aligns with the statement of the European Union member states made by Estonia. We would like to thank the Regional Director for her comprehensive report that contains important health priorities of our region. The non-communicable diseases continue to be the main cause of mortality and morbidity in many states, including Slovakia. Changing demographic situation brings necessity to reorient our focus on intersectorality, prevention, health literacy education, quality, and financial effectivity of services, bringing them closer to the patient. We welcome the work done to address communicable diseases as well. We acknowledge the WHO leadership in AMR. We look forward to next steps at global level, especially strong antibiotic stewardship to ensure the appropriate use of antibiotics in Euro region. We also appreciate the regional political commitment on tuberculosis. Slovak tuberculosis model shows favorable results and low incidence. We think it would be worth to share our experience and practices in the region. We appreciate the work done by Regional Office towards implementing the 2030 Agenda and the support provided to the governments, including intersectoral multi-country training seminar on Sustainable Development Goals in May 2017 in Bratislava. With diverse context, all countries in the region need workable instruments for intersectoral coordination and cooperation. And this is the agenda where we expect the WHO will keep further leadership. Let me conclude by saying that we strongly acknowledge the Regional Director's attention and dedication to this process. Thank you.
Thank you very much. Now I give the floor to the Russian Federation, to be followed by Germany.
President, Regional Director, the Russian Federation appreciates the work done by the European Regional Office over the last few years under your leadership. We note with pride that the contribution of the Russian Federation to all of the priority areas of the WHO has been reflected in your report. Colleagues, for many years now, the European region has been a leader in global health. The report of the Regional Director highlights the success stories of our region when it comes to reducing mortality and increasing life expectancy. However, inequalities between countries still exist in our region. A major contribution has been made by the Conference on NCDs. As part of the global program and regional program in this field, the Russian Federation continues to provide to the WHO financial and expert assistance. Over the last 5 years, Russia has adopted laws that are being upheld. Reforms are being taken regarding the determinants of health. This year, in Moscow, there is the remote office in Moscow on NCDs. In July 2016, the government of the Russian Federation agreed on a document to provide funds to this group on NCDs. We are developing policies and we are intensifying various activities to tackle NCDs. I should like to flag up the importance of work to overcome linguistic barriers when it comes to exchange and experience and practice. In November, we will be signing a document together with many others in Russian and in the other official languages of the WHO region. We continue to provide assistance when it comes to dealing with social diseases and illnesses. I should like to point out the joint decision between the WHO and the Russian Federation to have the first global conference on stopping TB in the age of sustainable development, I would like to take this opportunity to invite all countries to take part in the conference, which will be happening in November 2017 in Moscow. I am certain that this event will make a key contribution to stopping the spread of TB. Now, a problem that we've seen in recent years is AMR. It is one of the major threats to the modern world. And in this area, the European region is playing a key role. Russia attaches great attention to the issue of solving this matter at a regional and international level. Russia has developed two strategies, one to stop HIV infections and one to stop AMR. In the context of health decisions, I would like to point out something that was adopted recently among the CIS countries, namely a document to improve health in the CIS region. This ties in with Health 2020. We also have a Russian health concept as well. In addition, we have a CIS health agency which works with the WHO. We hope that the European office will be able to draw upon our sub-regional cooperation for the sake of joint efforts to achieve the highest possible level of health for the citizens of the European region. Thank you.
Thank you very much. Might I now give the floor to Germany, to be followed by Poland.
President, Regional Director, ladies and gentlemen, I would like to endorse what was said by the speakers, in particular that by the statement by the EU regarding strengthening health literacy in our region, and I would also like to support the statement of Austria. I would also like to take this opportunity to thank Hungary for the great hospitality reserved to us and for the excellent organisation of this meeting. I thank you for this. Susanne Jakob, the interim report which you presented deals with the work done by the European region, and it is a very impressive report. It is very clear we are on the right tracks here, provided that we overcome the barriers in health policy. I'm referring to what you mentioned with regard to the social determinants of health. So, in the European region, we have achieved a great deal already. The European region is making a key contribution along these lines. I also agree with previous speakers in saying that the focuses are right here. Health and the environment are key topics for the future. If I look to Middle and North America and I look at what's happening there, then we know that health care depends upon one's income, and so this is a major challenge when it comes to ensuring that all people have the same health care opportunities and access to such healthcare. I should like to point out that we have a responsibility to support the office in Bonn with regard to this particular challenge and these issues. AMR, strengthening health systems, all of these things are matters that played a key role at the G20 summit, and I should like to thank the WHO for the cooperation we've enjoyed, and also like to thank all of the others who are here today. I'd like to thank them for their support, for their work, and only jointly can we achieve success. Yes, HIV is very high, we've got the issue of TB, AMR, and of course we need to make progress along these lines. However, our region is one where HIV in recent years has been brought down substantially, and therefore We should continue the transformation process under the new DG and support this. We are ready to work along these lines. Germany is ready to engage more when it comes to the WHO. We want to continue to support the leading role of the WHO. Thank you. Poland, followed by Albania.
Thank you, Madam President. Mr. Director General, Dr. Tedros, Your Royal Highness, Madam Regional Director, Honorable Ministers. Firstly, Poland fully aligns itself with the statement made by Estonia on behalf of the EU and its member states. Secondly, I'd like to thank Dr. Jakab for her comprehensive report describing the activities of the regional office. We especially appreciate the efforts of the WHO in underscoring the fact that health is a precondition for achieving all the targets that the Agenda 2030 sets. Let us not forget that without our common effort, political commitment, cross-sectorial collaboration, we'll never reach the targets of the Sustainable Development Goals. Indeed, Dr. Tedros, your vision to clearly measure the organization's progress by the attainment of those targets is a good one. Thirdly, we have to underline that our engagement would be futile without health professionals, one of the pillars of every healthcare system. Poland regularly assesses the need of adapting health professionals to new roles and changing needs. This includes, inter alia, introducing new medical professions, expanding professional competencies and responsibilities of nurses and midwives, and introducing changes to the specialty training. We appreciate the work of WHO regarding health professionals. In this sense, we are grateful for the work of the regional office on the framework for action for sustainable health workforce, and we stand ready to promote WHO guidance in this regard, such as WHO Global Code of Practice on the international recruitment of health personnel. We urge all relevant stakeholders to abide by the rules set out in this code. And finally, Poland wishes to reassure the Director General that he can count on our region comprised of countries of different backgrounds, different ideas and different approaches to health, always willing to find a consensus for the benefit of health and well-being of our citizens. Thank you very much for your attention.
Thank you so much for your intervention. And now the last intervention before lunch will be Albania.
Thank you. Honorable Chair, Honorable General Director, distinguished ministers and head of delegations, ladies and gentlemen. The interim report of the Regional Director provides a broad description and deep analysis of the joint work of the Member States and the Secretariat. The report reflects clearly the vision and the leadership of Dr. Zuzanna Jakab in shaping the strategic direction of WHO Euro in harmony with the global policy and responding to the specific needs of the countries in the WHO European region. We have taken note of the progress in the governance reform, especially the accountability framework and the framework of engagement with non-state actors. The regional office has already identified the vulnerable countries along with the capacity building steps and is progressing with the health emergency program. The country presence of WHO is being strengthened. I would like to acknowledge the available and unique technical support of WHO in starting and keeping alive the health policy dialogue in Albania, finalizing with the drafting and endorsement of the Albanian National Health Strategy 2016-2020. Albania has aligned its national health policy with Health 2020, the European policy for health and well-being, which is aligned with the 2030 agenda. Strategy's vision is that universal health coverage is the cornerstone of health and welfare policies in Albania. Health is a right to everyone, not a privilege to a part of the population. We are aware that achieving universal health coverage and narrowing inequalities in accessing health services requires political will, national consensus, financial resources, and people support. The government of Albania has made progress in increasing the budgetary resources for the health system. In 2017, compared to 2013, the public expenditures for health increased roughly 40%. Health budget as a share of the government budget increased from 8.8% to over 10%. Health financing is share of GDP increased from 2.6% to 2.95%. In 2013, the ratio of public-private was 48% toward 52% in favor of private. In 2016, the ratio of public-private reached 55% versus 45%. For the first time, the public expenditures for healthcare are higher than private ones. Albania has an operational NCD action plan endorsed in 2016 that integrates risk factors on NCDs in line with the global and regional NCD policy. The Country Reproductive and Sexual Health Strategic Document and Action Plan 2017-2021 reflects predominantly the European Action Plan for Sexual and Reproductive Health towards achieving the 2030 Agenda for the Sustainable Development in the WHO European region, leaving no one behind. It was good to read in the report that the health system performance assessment is revitalized by WHO, and this is highly appreciated because independent, external, and credible assessment inform policymakers in an unbiased way. We thank WHO for 3 assessments conducted in January till August 2017. Primary health care in Albania, integrated management of childhood illness, cervical cancer control, providing recommendations for progress. The government of Albania is already reforming emergency care in Albania. The technical assistance in this area would be helpful and very much in line with the focus of WHO on the health emergency program. I would like to give credit to an important innovation of the WHO work in health data sharing, which is the European Health Informatization Gateway, a one-stop shop for data. In addition, member states are appreciating the opportunities brought about by EBPNet Europe to develop policy briefs and to establish mechanisms to translate evidence into policy. Thank you for your attention.
Thank you very much. And now let me stop here and break up for lunch. I think everybody's waiting for lunch, but please just remain seated for some information. I would like to remind you that the ministerial lunch will be with the Director General, Dr. Tedros, and it is for heads of delegations only, so that means 1 person per country, 1 person per delegation, and it will start immediately in Room Arcade. And sign and hostesses will show you the way to go to the lunch. And after the lunch, we will launch the health diplomacy book jointly with Prof. Kik Bush. And for the delegates, lunch will be served in the mirror corridor, and hostesses will also help your orientation. Please leave your headphones in the room. Other headphones will be provided for lunch on the spot. And one more technical information. The security door on the Novotel side will be closed during the lunch. And the last one is that after the lunch, we will continue with the same point on the agenda. So we will follow with the discussion about the regional director's speech and her intervention as well, or response as well. So thank you so much for the interventions, and bon appétit.
Welcome back. I hope you enjoyed your lunch. We shall continue with agenda item 2A, discussion on issues raised by the regional director, and we continue with our list. And I give the floor to Uzbekistan, followed by the former Yugoslav Republic of Macedonia. Uzbekistan, please.
Okay, thank you, Madam Chair. Honorable Director, Regional Director, Dr. Jakab, distinguished ministers, dear representatives, delegates and guests, ladies. Okay, sorry.
Madam President, Susanna Jakob, allow me to congratulate Susanna Jakob on her informative report. I would like to thank her for her decisive action and for her support to Uzbekistan. Thanks to the recommendations of the WHO, the results of the new stage of reform of the healthcare system in Uzbekistan in recent years have been largely connected with strengthening primary healthcare, improving the system to provide emergency medical care, to create a network of specialized medical institutions. I would like to point out that today in the region, at an intersectoral level, a pilot program is being introduced to solve problems related to communicable diseases, and various other measures are being taken. Now, one of the priority areas of cooperation between the Ministry of Health of Uzbekistan and the European Regional Office is preserving maternal and infantile health in Uzbekistan. We have a program for perinatal care and midwifery care. We've also got an intersectoral plan of action to prevent AMR and tackling this issue. The country has an intersectoral working group to develop a national plan of action, and this sees the participation of representatives of various agencies and ministries. The Medical Circle, international organisations including CDC, FAO and others. WHO experts provide assistance to the working group in developing documents outlining the strategic goals and various measures. We hope that the European Office will continue to support our country in implementing the SDGs. I should also like to point out that Uzbekistan is actively implementing the national programme to tackle TB. This programme has received recognition from the international community, and this was at the Wolfhazen meeting on TB for the European region in May 2017 in Hague, where Uzbekistan was called a country which was a top 3 leader in terms of implementing national programs and plans to tackle TB. Among all countries in the European region, we hope to further cooperate along these lines, and I would like to invite Madam Susanna Jakob. I would like to thank her. You talked about your time frame and calendar for the forthcoming years. We would like to see you in Uzbekistan in the near future. Thank you very much.
Thank you very much, and I give the floor to the former Yugoslav Republic of Macedonia, followed by Italy.
Okay, thank you. Second time I will start. No? Thank you, Madam Chair. Honorable Regional Director Dr. Jakob, distinguished ministers, dear representatives, delegates and guests, ladies and gentlemen, I would like to start by complimenting the Hungarian government for hosting this event. It's truly a pleasure to be here on this high-level meeting. Dear Madam Regional Director, thank you for your address and the comprehensive report. At this point, I would like to congratulate you and the Regional Office on the fine work in the past year. On behalf of the Republic of Macedonia, I would like to stress that we highly appreciate the assistance provided to us by the World Health Organization Country Office. I am glad to stress that we are closing on one of the most fruitful biennials, during which period, with joint forces, we have done a lot. Our main priorities for the past were communicable diseases, with a special action point on increased access to key intervention for people living with HIV/AIDS, then the prevention of control of the non-communicable diseases, prevention and control of NCDs with promotion of healthy lifestyle and healthy nutrition, promoting health through a life course approach with health again and health and environment analysis, working on our own National Health 2020 strategy, which focuses on integrated people-centered health services, as well as health information system strengthening and last but not last preparedness, surveillance and response for crisis situation in the context of the international health regulation for emergency risk and crisis management. Consequently, 3 key strategic documents guides were prepared by the Ministry of Health in close cooperation with WHO and endorsed by the government of Republic of Macedonia. First was Health 2020 strategy of the Republic of Macedonia. Second was Action Plan for Public Health until 2020 of the Republic of Macedonia. And the third one, National Health System Preparedness and Response Plan for Managing Emergencies, Crises and Catastrophes, 2017. Republic of Macedonia is one of the countries in Europe that performed the assessment of its health system toward better NCD outcomes. We are working along with WHO on a national NCDs action plan for the period 2017-2025 with global NCD monitoring framework and recent sustainable development goals. The plan follows the principles of the regional NCDs action plan 2016-2025 and the updated Annex 3 of the Global Action Plan. Lastly, let me express our appreciation to the WHO Euro Office and to the WHO Country Office, especially for the continuous cooperation and support, which has proven to be the successful way of working. I hope we shall go on in the same manner. Thank you for your attention.
Thank you very much, and I give the floor to Italy, followed by Luxembourg. Italy, the floor is yours.
Thank you, Chair. Italy aligns itself with the Estonian statement on behalf of the European Union member states. Thank you, Regional Director, for your comprehensive and convincing report. There is little doubt that the Euro region has improved its health status if we consider common average indicators. However, data disaggregation and the focus on certain population groups show that we are still living in a fragile ecosystem. We can be affected at any time by such elements as climate change, environmental degradation, financial constraints due to one of the worst economic crises after the Second World War, and the arrival or re-emergence of new or exotic communicable diseases such as West Nile fever, dengue, chikungunya, malaria itself, to quote a few. These are all issues that Italy has been addressing in partnership with WHO during the current 2017 G7 presidency. But we also feel we are under siege. Market forces continue developing new strategies that the public sector does not have the resources to combat. Tobacco smoking for all. We must react continuously to the recrudescence of anti-science movements that we have seen in practice in Italy with the anti-vax groups resisting vaccinations despite the evidence of a major measles outbreak, forcing the government to take drastic decisions with the recent introduction of a mandatory vaccination law. A major paradox risk is represented by the innovative medicines made available by advanced medical research. Unless we find a global mechanism to mitigate their financial impact, we will have to exclude selected patients from universal access to them. No individual country alone can afford paying 80,000 euros per year per patient for lung cancers, as we did last year with anti-C hepatitis drugs. Let me conclude underlining the need for WHO to support us in the most authoritative possible way, leading us on very practical issues when addressing not only the health sector, which is already literate and collaborative. We need a strong and ambitious WHO to address different interlocutors with different semantics, such as ministries of finance, of economic development, of education, as well as prime ministers, to advocate for the health sector to work and perform optimally. I hope and trust WHO will mobilize the Venice GDO in working with us in the region on these complex issues with innovative and state-of-the-art approaches, as anticipated in the new country cooperation strategy that Italy and WHO are going to sign during this regional committee. Thank you, Chair, and thank you, Hungary, for the great hospitality that we hope to provide with the same quality with the next year regional committee in Rome. Thank you.
Thank you very much, Italy, and I give the floor to Luxembourg, followed by Malta. Luxembourg, please.
Chairman, Regional Director of the World Health Organization, ladies and gentlemen, Luxembourg aligns itself with the statement made by Estonia on behalf of the EU and its member states. We welcome the report of the Director General because the subjects tackled within it are of crucial importance for the well-being of the people of our region. Chairman, I would like, with your permission, to emphasize one or two global challenges which we think are particularly worrying and which are therefore at the core of our national policy. First of all, global health security. Luxembourg attaches great importance to the effective implementation of the international health regulations. My government therefore welcomes the fact that WHO has learned the lessons of the past. We would like to congratulate them on that because they've certainly learned from what happened with the Ebola virus outbreak, and we now have a health emergency program to prevent, allow us to be better prepared for and respond to this type of global crisis. In the light of the recent crisis with eggs contaminated with fipronil, the serious, effective and speedy approach that we need to take to this kind of crisis in order to prevent health problems and emergencies means that we need to have food ethics as well, something which is often set aside to the benefit of health security. Moving on now to antimicrobial resistance, we are happy that this finally has become a major political priority, inter alia thanks to the constant efforts to make sure that it was by WHO, the European Commission and other member states. We hope that the discussions at the G20 Health Ministers Summit in Berlin last May will be fruitful. Luxembourg is at this very moment in the process of finalizing its first national action plan to control antimicrobial resistance. Let me now turn to the migration crisis. Given the current migration and refugee crisis, European countries continue to face a major challenge in trying to integrate the health needs of millions of needy people into their health systems. I'm thinking particularly of women, children, and unaccompanied minors. My country still regrets that many people in our region do not have appropriate access to health services. Failing to tackle the health problems of migrants and refugees is something that will damage public health in its entirety. That is why Luxembourg supports the setting up of mechanisms in countries of origin, countries of transit, and countries of destination, so as to have reliable data and exchanges of good practices. We fully support the development of a global action plan by WHO in Geneva. Before concluding this statement, let me just touch upon the important issue of health literacy. Together with Austria, Germany, Switzerland, and Liechtenstein, Luxembourg has made a political commitment to promote the regular collection of data internationally on the level of health literacy among our people. Health literacy constitutes one of the decisive factors in individuals being able to play a positive role in protecting and promoting their own health. We therefore fully support the statement made on this very important issue by Austria on behalf of the 5 countries I mentioned. Thank you.
Thank you very much, Luxembourg, and I give the floor to Malta, followed by the Netherlands. Malta, the floor is yours.
Thank you, Madam Chairman. I would also like to thank the Regional Director for her report and congratulate her on the achievements made not only during this past year, but also since she has taken office so very successfully in 2010. I would also like to state that Malta fully aligns itself with the statement delivered by Estonia on behalf of the European Union and its member states. I also take this opportunity to congratulate Dr. Tedros on his appointment as Director General, and I would like to offer Malta's continuing support to him and to the work of the WHO. The adoption of the 2030 Agenda for Sustainable Development, now about 2 years old, has presented the global community with fresh challenges and priorities. And we believe that the Health 2020 framework is an ideal framework from which one can work even towards achieving these SDGs. 2 of the main targets under goal number 3 are to reduce mortality from non-communicable diseases and to ensure universal healthcare. Now, with non-communicable diseases, we believe that, and I think most of us will share this, that obesity is one of the major risk factors contributing to non-communicable diseases worldwide. And therefore, we need, as a region, and indeed globally, to address this problem of obesity in a serious fashion. During the Maltese EU presidency, which occurred in the first 6 months of this year, we managed to come up with a set of council conclusions which promote cross-sectorial work in combating obesity, promote the setting up of national dietary guidelines for children, as well as guidelines for physical activity. We have also, together with the European Commission, launched a set of healthy food procurement guidelines for schools, and I urge member states to make use of this useful tool. In fact, ending childhood obesity was also one of the issues discussed during the meeting for health ministers for small states, of the Small States Network, which was held in Malta last June. And I would like to thank personally the regional director as well as her technical staff for providing valuable support, both technically and morally, for this holding of the Small Nations Network and similar meetings during the past years. As regards universal healthcare, we believe that access to medicines is an integral part of universal healthcare. And again, during our presidency of the Council of the European Union, we managed to present a framework for voluntary collaboration between health systems with particular reference to improving access to medicines. In fact, a group of member states, basically health ministers of Cyprus, Greece, Italy, Portugal, Spain, Ireland and Romania, joined Malta in signing the Valletta Declaration, whereby we agreed to commit to work together to get better access to new and innovative medicines and eventually to work towards joint procurement. So it is with satisfaction that I see that during this regional committee we will be discussing strengthening collaboration between member states also with regards to the access to medicines. In conclusion, Madam Chairman, Malta remains committed to continue with its efforts to address these health challenges and others, and to support the organisation in its ongoing work towards achieving the Sustainable Development Goals. Thank you.
Thank you very much, Malta, and I give the floor to the Netherlands, followed by Norway. The Netherlands, please.
Thank you, Chair. The Netherlands aligns itself with the statement made by Estonia on behalf of the EU and its member states. Regional Director, I also want to express our appreciation for the work that you and all your staff have done since our regional committee in Copenhagen last year. As your report states, our region is indeed leading to get the world's attention on tackling antimicrobial resistance. We are pleased with your work in supporting member states in the area of surveillance and stewardship. However, there's still a huge challenge in our region in developing national action plans on the basis of a One Health approach. We understand that half of the member states in this region doesn't have a national action plan. This is a problem, and we urge member states and the regional office to work on this urgent matter. The other area where we need to accelerate is the development of new antibiotics. Last week, under the leadership of the German Minister of Health, the Netherlands pledged to support the Global Antibiotic Research and Development Partnership, GARP, a joint initiative of WHO and DNDi. 56 million has been pledged so far. We call on the colleagues in this room to contribute too, because we collectively have to make progress in this area. Regional Director, I congratulate you too on your work to promote sexual and reproductive health and rights. With great appreciation, we have noted in your report that the work of your action plan is well underway. Your leadership in implementing the action plan and guidance matters to make sure that also in this region, everyone has the right to choose on matters related to sexuality, having children, and have access to comprehensive sexuality education. With reference to the International AIDS Conference in Amsterdam in July next year, as kindly mentioned by the Regional Director, I would like to reiterate that it is an outstanding opportunity to re-emphasize the importance of adequate HIV, TB, and hepatitis response in the European region. The conference brings together all stakeholders. It serves as a space where not only the latest scientific developments are shared, but where people from different backgrounds meet and discuss on the best way forward. If we want to reach SDG 3.3 by ending AIDS and other deadly diseases by 2030, Europe cannot be complacent. In our region, there is still work to do. Collectively, we can reach the targets and serve as an example for the global arena. Therefore, we will welcome you all in Amsterdam in July next year. Thank you.
Thank you very much to the Netherlands. And I have the following speakers on my list: Norway, the Republic of Moldova, Serbia, Turkey, Ukraine, Denmark, and Belarus. And then we have observers wishing to speak. I will now give the floor to Norway.
Madam President, Director General, Regional Director, ladies and gentlemen. Norway thanks the Regional Director for the comprehensive and informative report. We value highly the strong efforts the region has made in health emergencies, preparedness and response, and appreciate that the region now has a fully functional emergency program implemented, despite resource constraints. We noted with interest the training the regional office provides to Syrian health personnel in Turkey in order to reach Syrian refugees in Turkey. We are always listening in also to topics that are not mentioned, and for that reason I would just like to remind us all that abuse and violence to children, youth and women are still major health concerns in the European region. Last year, Norway commended the regional office for its improvement in alignment, accountability and transparency. This year, we note that the regional office continues to deliver in these important areas of WHO reform. For instance, the document regarding the country performance in the European region on governance, and that on the regional implementation plan for the program budget 2018-19, all provide relevant background information, oversight, and makes it possible for member states to engage in meaningful strategic discussions. We commend the clear intention of the regional office to follow up and implement actions central to WHO reform as agreed at the global level, and at the same time underline that this development must continue. Finally, Norway would like to thank the Regional Director for addressing affordable access to medicines. By taking on a leadership role in these matters, the Regional Office is demonstrating its continued relevance to countries at all stages of development. Finally, also, we would like to thank Hungary for hosting generously this important event. Thank you.
Thank you very much, Norway. And knowing that our Director General has the opportunity to follow our discussion here till 4 o'clock, and then you will meet for a bilateral meeting, with your permission, I will propose that we suspend this discussion on this RD's speech, and we will continue with the general program of work that the Director General can follow our discussions in this committee, and we will then come back to the speakers on my list as I mentioned before. Is this acceptable for you?